As the president stays at Walter Reed, the hospital in D.C., his chief of staff, Mark Meadows, wearing a mask, passed out gifts to a small group of Trump supporters gathered outside last night. Meadows told the crowd, and I'm quoting here, he's doing well, he's in good spirits, he loves America. And that, as Eva mentioned, brings us to our GMA cover story, a look inside the storied medical center that is housing the president as he fights COVID-19. Here it is. It is known as Ward 71, the presidential suite inside Walter Reed Medical Center, where the president and other high-ranking administration officials get treatment. President Trump will be working from this wing of the hospital for the next several days as he receives treatment for COVID-19. The ward, seen in these 2007 pictures from USA Today, equipped with offices and conference rooms in order to receive visitors and hold meetings. The section of the hospital even coming with a dining room to make high-profile patients feel at home. For years, Walter Reed has served as the main medical care facility for American presidents. President Reagan underwent surgery. President Nixon was treated for pneumonia. And it's where the body of President Kennedy was taken after that tragic day in November 1963. Inside the facility, there are bedrooms for the president, first lady, and guests. And while much is kept private, archival descriptions say there are 9 rooms that cover a full floor of the old hospital building, a place that President Trump will call home for the next several days.
And let's bring back our chief medical correspondent, Dr. Jen Ashton, to talk more about all of this. Dr. Ashton, good to see you again. Why would the president's medical team admit him to Walter Reed? We know that the White House is equipped with all sorts of medical care and facilities there. Why that decision to move to Walter Reed?
Well, Whit, I think it's really important to distinguish between the care that the president receives and the care that an average person just diagnosed with mild COVID-19 would be getting. We know that 80% of people with mild disease can be managed at home. And as you said, the White House definitely capable of giving supplemental oxygen and IV fluids if they need to. When the White House said it was out of an abundance of caution, I actually think it was the opposite. I actually think they are taking no chances with the president's health, and that it was an aggressive therapeutic move because they want to give him all of the best treatments early on, even though, as per the latest reports, he is not even requiring supplemental oxygen. He's been getting treatments that we normally see reserved for patients with more severe disease. But reasons to transfer someone to the hospital if they need real-time monitoring, let's say with EKGs, if they need stat blood results, where you get the results within the hour, if more aggressive treatments are needed, either for pulmonary or cardiac issues, or if they require other services like anesthesiologists or specialists that really just work in a hospital setting. But again, I think what we're seeing here is very aggressive medical management of arguably the most powerful person in the world.
Yeah, this is not your average patient. It's the president of the United States. So I do want to talk about his inner circle, because we've seen a number of people testing positive, obviously people in the White House, his wife Melania and others. How important is it to go look back at his behavior and his travel leading up to the diagnosis?
Well, in clinical medicine, behavior is always important. We talk about it so often, Whit, and obviously it can affect the likelihood of someone developing a disease. But I want to be crystal clear. Medicine is a judgment-free zone. So the analogy here is we would never take a patient just diagnosed, let's say, with lung cancer who had been a lifelong smoker and then go back and blame the patient for that disease or that diagnosis. We take care of the patient in the acute medical crisis, and there is plenty of time moving forward to try to affect behavioral change.
That's right. And then there's the ripple effect and the contact tracing that will take place as well. Dr. Jen, as always, thank you so much. We do appreciate it on this very important and developing story.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.